Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A nurse is assessing a client with suspected sepsis. Which finding should the nurse recognize as an early sign of sepsis? A. Bradycardia. B. Hypothermia, 95 degrees Fahrenheit per 35 degrees Celsius. C. Tachycardia and fever. D. Hypertension. Correct answer, C. Tachycardia and fever. Rationale: early sepsis commonly presents with fever, tachycardia, tachypnea, and an elevated white blood cell count. Question 2. A client with sepsis has a blood pressure of 82/50 mmHg despite receiving 4 fluids. Which medication does the nurse anticipate administering next? A. Furosemide. B. Norepinephrine. C. Insulin. D. Morphine. Correct answer, B. Norepinephrine. Rationale: if hypotension persists after adequate fluid resuscitation, vasopressors such as norepinephrine are the first-line treatment for septic shock. Question 3. Which client is at the highest risk for developing sepsis? A. A healthy 20-year-old with a sprained ankle. B. A 75-year-old with pneumonia and diabetes. C. A 30-year-old with seasonal allergies. D. A 25-year-old with a migraine. Correct answer, B. A 75-year-old with pneumonia and diabetes. Rationale: older adults and clients with chronic illnesses or infections are at increased risk for sepsis. Question 4. A nurse suspects sepsis in a hospitalized client. Which action should the nurse perform first? A. Administer antibiotics immediately without notifying the provider. B. Notify the healthcare provider and activate the sepsis protocol. C. Encourage oral fluids. D. Place the client in Trendelenburg position. Correct answer, B. Notify the healthcare provider and activate the sepsis protocol. Rationale: early recognition and activation of the sepsis protocol are essential to improve outcomes. Question 5. Which laboratory value is most commonly elevated in a client with sepsis? A. Hemoglobin. B. Lactate. C. Calcium. D. Albumin. Correct answer, B. Lactate. Rationale: elevated serum lactate indicates tissue hypoperfusion and is an important marker of severe sepsis. Question 6. A nurse is caring for a client with septic shock. Which assessment finding requires immediate intervention? A. Temperature of 101.8 degrees Fahrenheit 38.8 degrees Celsius. B. Blood pressure of 78/44 mm of mercury. C. Heart rate of 108 beats/min. D. Respiratory rate of 24 breaths/min. Correct answer, B. Blood pressure of 78/44 mm of mercury. Rationale: severe hypotension indicates poor tissue perfusion and requires immediate intervention. Question 7. Which prescribed intervention should the nurse implement within the first hour of recognizing sepsis? A. Delay antibiotics until culture results return. B. Administer broad-spectrum antibiotics as prescribed. C. Restrict 4 fluids. D. Place the client on complete bed rest only. Correct answer, B. Administer broad-spectrum antibiotics as prescribed. Rationale: early administration of broad-spectrum antibiotics is a key component of the sepsis treatment bundle. Question 8. Which assessment finding suggests that a client with sepsis is improving? A. Urine output decreases to 15 milliliters per hour. B. Mean arterial pressure, MAP, increases to 68 millimeters of mercury after treatment. C. Serum lactate continues to rise. D. Mental status becomes more confused. Correct answer, B. Mean arterial pressure, MAP, increases to 68 millimeters of mercury after treatment. Rationale: a MAP of at least 65 millimeters of mercury indicates improved organ perfusion. Question 9. A client with sepsis becomes confused and restless. What is the nurse's priority action? A. Apply wrist restraints. B. Assess oxygenation and notify the healthcare provider. C. Encourage the client to sleep. D. Administer a sedative. Correct answer, B. Assess oxygenation and notify the healthcare provider. Rationale: altered mental status may indicate worsening hypoperfusion or hypoxia and requires immediate assessment. Question 10. A nurse is teaching a student about septic shock. Which statement by the student indicates correct understanding? A. Septic shock occurs only after surgery. B. Septic shock is a life-threatening condition caused by infection leading to circulatory and organ dysfunction. C. Antibiotics should be delayed until all culture results are available. D. Fluid resuscitation is not recommended in septic shock. Correct answer, B. Septic shock is a life-threatening condition caused by infection leading to circulatory and organ dysfunction. Rationale: septic shock is a severe form of sepsis characterized by persistent hypotension and inadequate tissue perfusion despite fluid resuscitation. Early recognition, for fluids, antibiotics, and vasopressors are critical to improving survival. Question 11. A client with sepsis has a serum lactate level of 5.2 millimoles per liter. What does this finding indicate? A. Adequate tissue perfusion. B. Poor tissue perfusion and possible septic shock. C. Normal kidney function. D. Respiratory alkalosis. Correct answer, B. Poor tissue perfusion and possible septic shock. Rationale: elevated lactate levels indicate inadequate tissue oxygenation and are associated with severe sepsis and septic shock. Question 12. A client with sepsis is receiving 4 antibiotics. Which nursing action is most important before administering the first dose? A. Obtain blood cultures as prescribed. B. Administer acetaminophen. C. Encourage oral fluids. D. Check the client's blood glucose. Correct answer, A. Obtain blood cultures as prescribed. Rationale: blood cultures should be collected before starting antibiotics whenever possible to identify the causative organism. Question 13. Which assessment finding suggests a client is progressing from sepsis to septic shock? A. Blood pressure of 124/78 mmHg. B. Warm, dry skin. C. Persistent hypotension despite 4 fluids. D. Heart rate of 88 beats/min. Correct answer, C. Persistent hypotension despite 4 fluids. Rationale: septic shock is characterized by hypotension that does not improve with adequate fluid resuscitation. Question 14. A nurse is caring for a client with sepsis. Which finding requires immediate reporting to the healthcare provider? A. Urine output of 15 milliliters per hour. B. Temperature of 100.8 degrees Fahrenheit 38.2 degrees Celsius. C. Heart rate of 102 beats/min. D. Respiratory rate of 22 breaths/min. Correct answer, A. Urine output of 15 milliliters per hour. Rationale: low urine output indicates decreased kidney perfusion and possible organ dysfunction. Question 15. Which laboratory result is commonly seen in clients with bacterial sepsis? A. Decreased white blood cell count only. B. Elevated white blood cell count. C. Low platelet count only. D. Elevated calcium level. Correct answer, B. Elevated white blood cell count. Rationale: many clients with bacterial sepsis have leukocytosis as part of the inflammatory response. Question 16. Which intervention should the nurse implement first for a client with suspected sepsis and an oxygen saturation of 88%? A. Start oxygen therapy. B. Obtain a urine specimen. C. Insert a urinary catheter. D. Administer pain medication. Correct answer, A. Start oxygen therapy. Rationale: maintaining adequate oxygenation is a priority because sepsis can rapidly impair tissue oxygen delivery. Question 17. Which client is most likely to develop hospital-acquired sepsis? A. A healthy client recovering from a sprained ankle. B. A client with a central venous catheter and recent abdominal surgery. C. A client with seasonal allergies. D. A client receiving treatment for migraine headaches. Correct answer, B. A client with a central venous catheter and recent abdominal surgery. Rationale: invasive devices and recent surgery increase the risk of healthcare-associated infections and sepsis. Question 18. A client with septic shock is receiving norepinephrine. Which assessment finding indicates the medication is effective? A. Blood pressure increases to 100/68 mmHg. B. Heart rate decreases to 40 beats/min. C. Temperature increases to 103 degrees Fahrenheit 39.4 degrees Celsius. D. Oxygen saturation decreases to 86%. Correct answer, A. Blood pressure increases to 100/68 mmHg. Rationale: norepinephrine improves vascular tone, increasing blood pressure and organ perfusion. Question 19. Which client statement indicates an understanding of how to reduce the risk of sepsis? A. I'll stop taking antibiotics once I feel better. B. I'll complete my entire course of antibiotics as prescribed. C. I don't need to wash my hands if I wear gloves. D. I should ignore signs of infection unless I have a fever. Correct answer, B. I'll complete my entire course of antibiotics as prescribed. Rationale: completing prescribed antibiotics helps eliminate infection and reduces the risk of progression to sepsis. Question 20. A nurse is caring for 4 clients. Which client should the nurse assess first? A. A client with sepsis whose blood pressure has dropped from 118/76 mmHg to 86/52 mmHg. B. A client with pneumonia requesting pain medication. C. A client with a urinary tract infection waiting for discharge instructions. D. A client receiving 4 antibiotics with a temperature of 100.2 degrees Fahrenheit 37.9 degrees Celsius. Correct answer, A. A client with sepsis whose blood pressure has dropped from 118/76 mmHg to 86/52 mmHg. Rationale: a sudden drop in blood pressure in a client with sepsis suggests progression to septic shock, which is life-threatening and requires immediate intervention. Question 21. A client with sepsis suddenly becomes cold, clammy, and difficult to arouse. What should the nurse do first? A. Encourage oral fluids. B. Assess the airway, breathing, and circulation, ABCs. C. Obtain another temperature. D. Place the client in high Fowler's position. Correct answer, B. Assess the airway, breathing, and circulation, ABCs. Rationale: a change in mental status and signs of poor perfusion indicate deterioration. The priority is to assess and stabilize the ABCs. Question 22. Which finding indicates that fluid resuscitation for sepsis has been effective? A. Urine output increases to 35 milliliters per hour. B. Heart rate increases to 130 beats/min. C. Lactate level continues to rise. D. Blood pressure decreases to 80/46 millimeter of mercury. Correct answer, A. Urine output increases to 35 milliliters per hour. Rationale: adequate urine output, greater than or equal to 30 milliliters per hour, is a sign of improved kidney perfusion. Question 23. A nurse is caring for a client with septic shock. Which assessment finding indicates worsening organ perfusion? A. Warm skin. B. Confusion and decreased urine output. C. Heart rate of 88 beats/min. D. Oxygen saturation of 98%. Correct answer, B. Confusion and decreased urine output. Rationale: altered mental status and oliguria are signs of inadequate organ perfusion. Question 24. Which laboratory value is most useful for monitoring a client's response to sepsis treatment? A. Serum lactate. B. Hemoglobin. C. Calcium. D. Cholesterol. Correct answer, A. Serum lactate. Rationale: a decreasing lactate level indicates improving tissue perfusion. Question 25. A client with sepsis is receiving broad-spectrum antibiotics. Which assessment finding suggests an allergic reaction? A. Fever. B. Rash with difficulty breathing. C. Heart rate of 100 beats/min. D. Blood pressure of 118/72 mmHg. Correct answer, B. Rash with difficulty breathing. Rationale: rash accompanied by respiratory distress suggests a serious allergic reaction requiring immediate intervention. Question 26. Which client has the highest priority for sepsis screening? A. A client with a sore throat and stable vital signs. B. A client with pneumonia, fever, confusion, and hypotension. C. A client with controlled hypertension. D. A client recovering from a sprained ankle. Correct answer, B. A client with pneumonia, fever, confusion, and hypotension. Rationale: infection plus altered mental status and hypotension strongly suggests sepsis. Question 27. A client with sepsis asks why 4 fluids are being given so rapidly. What is the nurse's best response? A. They help improve blood flow to your organs. B. They reduce your fever. C. They eliminate the infection. D. They lower your white blood cell count. Correct answer, A. They help improve blood flow to your organs. Rationale: rapid 4 fluids help restore circulating volume and improve tissue perfusion. Question 28. Which finding indicates that a client with sepsis may require mechanical ventilation? A. Oxygen saturation of 82% despite oxygen therapy. B. Temperature of 100.6 degrees Fahrenheit 38.1 degrees Celsius. C. Heart rate of 102 beats/min. D. White blood cell count of 14,000/mm superscript 3. Correct answer, A. Oxygen saturation of 82% despite oxygen therapy. Rationale: persistent hypoxemia despite oxygen therapy may require ventilatory support. Question 29. Which statement by the nurse demonstrates correct teaching about preventing sepsis? A. Wash your hands before and after wound care. B. Stop antibiotics when you feel better. C. Avoid vaccinations. D. Only seek medical care if your fever lasts more than 1 week. Correct answer, A. Wash your hands before and after wound care. Rationale: proper hand hygiene is one of the most effective ways to prevent infection and sepsis. Question 30. A nurse is evaluating a client after treatment for septic shock. Which finding indicates the best outcome? A. Blood pressure 118/76 mmHg, MAP 70 mm of mercury, urine output 40 ml per hour, and lactate level decreasing. B. Blood pressure 82/48 mmHg with increasing confusion. C. Urine output 10 ml per hour and rising lactate. D. Persistent hypotension requiring increasing vasopressor doses. Correct answer, A. Blood pressure 118/76 mmHg, MAP 70 mm of mercury, urine output 40 ml per hour, and lactate level decreasing. Rationale: stable blood pressure, adequate urine output, a MAP of at least 65 mm of mercury, and a declining lactate level indicate improved tissue perfusion and successful treatment of sepsis. Comment your score out of 30 below. If this video helped you, don't forget to like, subscribe, and share it with a fellow nursing student. I'll see you in the next NCLEX practice session.